Any questions before? We got to unmute you. There, we got you. All right.
You can hear me now, yes? All right, fantastic. Well, what an excellent introduction. I really appreciate that. You've really been very thoughtful on this topic. I'm going to try to also have some space here so that I'm going to have a very dynamic, very fun conversation, be very provocative as well. It could go on for like 40 plus minutes though, but it sounds like this group looks very dynamic. So I'm going to try to breeze through some parts so we have more space for Q&A and we'll have a good time. I'm going to jump in for a quick 1-minute intro video and think about that in terms of implications of the world. For some background, I'm a PhD in computer science. I used to be a software engineer many years ago. So I really relate to a lot of the principles you're talking about, engineering principles and credentialing. What do you validate? What's trustworthy or not? And medicine is the most regulated and most scrutinized in terms of credentialing quality and practice. So take that into mind about where we go, and the stakes can be very high. Some acknowledgement disclosures, some learning objectives, and a 1-minute introduction.
Greetings, everyone, and welcome to a discussion on the potential of AI technologies for healthcare. Before we dive in, allow me to introduce myself, although that phrase may take on a surreal meaning today. I'm not the real speaker, nor did the real speaker write this introduction. The voice you're hearing, the image you're seeing on the screen, and even these introductory words were all generated by AI systems. We are actively amidst the arrival of a set of disruptive technologies that are changing the way all of us do our work and live our lives. These profound capabilities and potential applications could reshape healthcare, offering both new opportunities and ethical challenges. To make sure we're still anchored in reality, however, let's welcome the real-life version of our speaker. Take it away, Dr. Jonathan Chen, before they start thinking, I'm the one who went to medical school.
Wow.
Greetings, everyone.
Well, gosh, thank you for that kind introduction. That was weird. I don't know, folks. Do I actually have to be here today? I'm pretty sure AI could just give our presentations for us at this point. I certainly hope and wish AI could help me manage the overwhelming flood of emails and in-basket messages I have to respond to every day and help open up new paradigms of care to reach patients who need us. Look, ready or not, good or bad, Pandora's box already has been open, and our students are using these AI chatbot large language model systems for every reason you can imagine and many reasons you could not imagine, including to do their homework and their take-home exams without even attempting to edit the robot-generated content. Our whole nature of education, assessment, accreditation has been completely turned upside down on its head. It just does not make sense anymore. We have to rethink how we do all of this. Let alone education. What about medical advice and counseling? It is clear that despite a thin layer of disclaimers, regular people are using these types of tools to get medical advice, if not to diagnose and treat themselves, and to diagnose and treat their dogs. I gave a version of this presentation to some of my medical trainees in the hospital a year ago. They stopped me halfway and said, wait a minute, Dr. Chen, I don't understand. We are totally using AI chatbots in the intensive care unit rounds right now. Are we not supposed to be using this as a medical reference? And I said, no, you should not use these tools as medical references. It doesn't mean you can't use them, but just understand what they are and what they are not. And a reference is definitely not what they are. A lot of these emerging large language model chatbot system, it's kind of like autocomplete on steroids, basically. What's autocomplete, right? You go to the internet, you search for coronary artery. What happens? Autocomplete shows up. Did you mean coronary artery disease? Coronary artery calcification? How does it do this? How does this computer know what you wanted to say before you've even completed your thought? What it did is they just counted the last thousands, maybe millions of times somebody searched for something like this. Oh, well, 13% of the time they said coronary artery calcification, 6.5% of times it was score. Every one of these numbers represents a parameter an underlying language model has learned about how often different words are associated with each other. But why stop at search terms? What if we took every book ever published, every newspaper article, every PubMed article, every Twitter and Reddit conversation, you pour the internet basically into a gigantic large language model, learning all of the different ways that words are often associated with each other. And what's really weird, it's just autocomplete. that's fine. What's the big deal? When it grows to a certain scale, when you've memorized enough of the internet, it sure looks like this thing can summarize, it can translate, it can answer questions, it can generate ideas, it can reason with a theory of mind. That's what it looks like it can do. Many in the field, including myself, were quite surprised. Whoa, how does such a primitive concept manifest such sophisticated looking capabilities? Perhaps we shouldn't be that surprised, though, because all of your intellectual and emotional thought that you prize so dearly, how do you express and communicate that but through the language and medium of words? So perhaps it's not that strange. If a computer is so fast on manipulating words, it creates a very convincing illusion of intelligence, even though under the hood, to some degree, it's just a very sophisticated autocomplete system. Just as a fun demo to kind of get us thinking about what's possible. The most popular toy and puzzle in history, Rubik's Cube. I bet many people in here played with one of these before. Over 43 quintillion possible configurations. If you tried to brute force to solve one, it would take you longer than the history of the universe. But if you apply deliberate techniques, you can actually solve one much more rapidly than you might expect. That might have been a little bit fast. I'll do it again. I got another one here. But watch close. Do not blink. Otherwise, you might miss the moment they get solved. I know what you're thinking. I know what you're thinking. This has got to be a trick cube. What is it? Is there rubber bands in here? Is there a motor or LED panels? Like, no, I promise it's actually a legit cube. It's not like this thing has a reset button where you just flick it on side and then it just solves itself. Maybe this thing, does this have a switch in it where it goes from like solve to unsolved, solve to unsolved? That is not what's happening. That's not what's happening. You must consider the possibility. Is this just an illusion? Maybe this thing was actually not mixed up on all six sides. You can see for yourself. I promise you this is absolutely legit normal cube. But if you apply a deliberate technique, you can again solve it much more rapidly than you might expect. But that's not magic. That's not magic. It's algorithms. Advanced algorithms applied to a complex problem in a deliberate manner. How might some of this be used in a medical setting, in a high-stakes, important, complex setting? What does your typical, doctor's office look like? Now we have in-basket messages. It's great that you can basically email your doctor, your nurse for advice, having access to patients. That's a good thing. Nobody gave the doctors and nurses time to figure out how to answer literally 100 messages per day. So now it's this overwhelming, constraint, non-optimized system. So we're already piloting at Stanford. Maybe let the AI read the patient's email, their message, and generate a draft to just respond to them automatically. Right now, the doctor or nurse or pharmacist has to edit and verify before sending it back, but very clearly this direction is going. You're probably not going to be talking to a human. You're probably going to be talking to a robot very soon. And no overt major safety issues yet. Weirdly, it doesn't save us time yet, because if you have to edit and double check something, you kind of might as well have just written that one line message yourself. But it does make the practitioner side feel way better, like they're not burned out to death with overwhelming paperwork. They can focus more on patient care questions. Other things that are becoming quite prevalent. Multiple companies have sprouted in the past few years as a rapidly growing and getting a saturated field. What does your typical doctor's visit look like? Hello, ma'am. What are you here for? Oh, you're here for a urine infection. Okay, and you need some blood pressure medicine. And oh, your mom died last week. Oh, so sorry to hear that. And I need to know if you smoke cigarettes and what pharmacy you want to go to, right? This computer is this data-hungry machine. So your doctor spends most of their eyes on the computer trying to deal with this artifact rather than deal with you. Wouldn't it be nice if your next doctor's visit was just you and another human being having a conversation and really talking about what matters to you, and then let a computer transcribe the conversation automatically? Obviously, Zoom meetings can do this, PowerPoint can do this. Transcription is not a strange phenomenon at all. But you can't just upload a transcription to electronic medical record. A clinical note has certain structure and purpose and meaning and thought to it. And so what that means is pajama time. So your doctors, after they go home, they're seeing, right, 6 patients per hour, if not more, overbooked. Finally, at 9 p.m. at night, all right, had some dinner, sent the kids to bed. I can finally sit down and finish my charting and document all the stuff that happened the day, if I can remember what happened with that patient, so I can get the proper documentation in so that medical care happens going forward. Here are these ambient scribes, just listen to conversations, draft the documents, and at least in this pilot done at Stanford, looks like on average, it really actually saves people maybe 20 to 30 minutes of their time. So it makes some concrete difference in addition to just making people feel better. They're not drowning in paperwork rather than helping patients. I'll just breeze through this one, but this just shows you concretely we've made patient privacy secure versions of essentially ChatGPT and these types of tools at Stanford. And these are the most common things people are using it for right now. A lot of it's helping communicate with patients. Basically, hey, I did all this stuff for the patient, but I need to write them some instructions and note to tell them what that means. Doctors don't do a very good job of explaining things to patients. You need to take that aspirin and Plavix for your coronary artery disease after we put that stent in place for a heart attack. Like what, right? It's actually really important you take this medication, but most patients they don't understand those words and the doctor doesn't take time to explain it. So could you translate this into words that is accessible at a fifth grade reading level in lay terms? It still understands how it's important. We definitely use this to help us make diagnoses. I've used these tools in real life practice not because I didn't know, but it was nice to have a second opinion on some things and the sort of paperwork tasks. Even though in research on the x-axis, most research studies are like medical test questions because that's an easy thing to study, not because it's the most important thing we need. Before you get too excited though, hopefully you all know about confabulation. The more popular term is hallucination. I don't really like that term because that implies somebody who believes something that is not true. These AI chatbots, they don't believe anything. They don't think. They don't know. They don't understand. What they do is they string together words into a believable sequence, even if there's no underlying meaning. That is the perfect description of confabulation. It's like your chatbot has an alcohol problem and they have Wernicke-Korsakoff syndrome. They're not trying to lie to you. They're not trying to say something wrong. It's that they just don't know and they're just stringing together words trying to make a sentence complete. What could that mean if you're having high stakes medical issues? I asked a chatbot here, how do you prescribe, how are opioids like morphine, fentanyl, oxycodone good for patients with heart failure? Here, this chatbot tries to resist. It says, I'm not sure that's true, but if you say so, okay. This is how opioids are good for heart failure. And here's some references. So go look up these references, go look up these PubMed IDs, and you will find that none of these articles actually exist. The chatbot's just making up references. It does this about 30% of the time. It doesn't know what a reference is. It's just stringing together author names and title words together into something that looks like a reference because that's what you ask it to do. These things are very advanced autocomplete systems. They have no sense of knowledge, truth, or reality. They also have a very poor sense of numbers and time. It's just not, they're word association machines. Here's a fun story. I'll try to be brief with this one. Think about the world we live in now. It's very different. You thought about that opening thing where this AI avatar introduced me. Oh, that was kind of funny, wasn't it? Listen to this story. A Hong Kong finance worker, he gets an email from his boss, the CFO. We need to transfer some funds over to a different account. He's like, really? He emails back. Can I get on a quick Zoom meeting? I just want to make sure I understand what I'm supposed to do. Emails back, okay. He gets on the video call. There's his boss, the CFO. There's all his coworkers. They're on the call too. They're just nodding along. His boss says, yes, we just have some different clients now. We need to move some funds. It's fine. Go ahead and do the transfer. Okay. Click transfer. $25 million. First of its kind. One of the largest cyber scams in history. That wasn't his boss. That wasn't his coworkers. Someone just downloaded their pictures and got a sample of their voice and then created these AI avatars to impersonate these people. This guy, he thought something was off. The email sounded weird. So he double checked. He got on a video call to make sure everything was right. And still that was not enough. He was fooled by these very realistic but deceptive practices. Sure. Just to make sure we're all pinned. If you have any questions or comments, we could break for some. Otherwise, I'm gonna do a little demo just to make sure you're all still awake. I know it's hard to llisten to a Zoom lecture for too long.
We saw 25 million, so we're good. So
I was like, what can you believe anymore? Like, I mean, how do you know I'm not a robot right now? Really, how do you know? Because I have a photo here, because I'm talking, I have a voice, my sentences sound complete. Those are not reliable indicators of truth anymore. We are converging upon a really weird point in history where human versus computer generated images, real versus fabricated information, you can't tell the difference anymore. Although brief demo just to make sure you're all still awake here. Look at this. Look, I got this metal ring. People think there's just technology in here. No, it's a piece of metal, right? But if I toss it on, I can put it on with one finger. Toss it on. one finger. But if I do that so fast, it almost looks like magic. It's not, right? Bring it from the ring finger onto the pinky. Watch the pinky. Watch the pinky. It almost looks like it goes right through the finger. People think there's like the hole in here, but there's not. You just take that and you can actually close it so it ends up looking almost more like a coin or something. If you take that and toss it in here, you can actually take the coin looking thing and just stick your finger back in to create a ring. Peel it off, toss it back on. All right, here. Watch the center, watch the center. And you actually see the moment that it turns back into a ring. Can you believe this? This is maybe all video trickery, AI generated nonsense for all you know. How could you tell the difference anymore? The reality is, in a lot of disciplines, including medicine and others, it's okay if something is not right all the time. I mean, humans aren't right all the time, right? Lab tests aren't right all the time. But what you do need is you need some measure of uncertainty. If you tell me, I'm not sure, but I'm 70% sure this is the right answer, you can still work with that in a very rational way. So how can you do when you're talking to AI chatbot? You could just say, hey, AI chatbot, what's the capital of New Jersey? On a scale of 0 to 100, how sure are you? If you do that, it'll give you a number. It'll just make up a number, but that number doesn't mean anything. It has no meaning. You can ask it. It just doesn't know what it mean anything. A more practical approach, if you really want to do, you could basically look for consistency. If you ask the same question, there's a certain randomness we notice, stochasticity. You ask the same question to chatbot, it'll make a different answer every time. If it gives you the same answer 9 out of 10 times, it is probably correct. If it gives you the same answer 4 out of 10 times, I recommend you check another source because that means it doesn't really know what's going on and it's just making it up as it goes. And the problem is it doesn't tell you that it's unsure. You have to have some other approaches to figure out how to narrow that down. More and more, you're going to hear about retrieval augmented generation. These are techniques where, hey, AI, chatbot, how do I prescribe opioids? Man, I don't care what the chatbot thinks. Who knows what random corner of the internet is reading that off of, right? These are combination techniques. Open evidence is a really nice tool. It's used by more for physicians right now. Opioids, how to prescribe it. What it first does on the right, it goes to PubMed. It looks up articles and references and guidelines and tries to prioritize ones that seem more trustworthy. And then it's not what the chatbot thinks. The chatbot reads those articles and says, well, according to these articles, I think this is the answer. And here's some links back to the references so you can trust but verify and see why I'm saying this. A much more coherent technique when you need reliable answers to complex questions, although also realize it still is not perfect. I've used this in practice. I had a resident, a medical trainee, taking care of a patient with really bad alcohol withdrawal, and she picked this treatment, phenobarbital, which I was like, that's weird. Why would you do that? That's not what I would have done. I don't know. I asked this thing, and it told me to do that for severe cases. Really? Let me try. I asked it the same question. It gave a slightly different answer. It says, oh, well, first line treatment is benzodiazepine. Second line treatment is phenobarbital. I'm like, ooh, that's a very subtle difference, that variation way to answer it. And it led to a difference in patient treatment. So that means a difference in patient outcomes as well. This is a good technique, but it is not foolproof either. Let alone reading practice guidelines, documentation, insurance protocols, hospital processes. What if you could have a chatbot read your entire electronic medical record for you? This is not ready for prime time, but is very clearly where the future is going in the not distant future. We did a test here, real patient charts. Have you gone to like a doctor's visit and then you have to like say the same story for the 20th time, even though you've heard it many times? Like, couldn't you have just read my chart, doctor? It's all in there. And the reality is your doctor does try to do that. It's just hard, right? They have to do homework the night before, and they were up the last night finishing their charts from the day before, let alone doing homework for the next day. And then they got to dig through hundreds of documents trying to put it together. So we said, hey, let's, in this example, nasal congestion, going to an ear, nose, and throat doctor. And you got to make it answerable. So let's 30 binary questions. Yes or no. Has the patient taken antibiotics? Has the patient had a CT scan? Has the patient had allergies? All this stuff the specialist would want to know before they even show up. And then we had 2 human doctors review the charts to confirm what the correct answer to these questions should be. But let's see how good a chatbot, in this case GPT-4, could do reading the charts. So here's what happened so far. The computer auto-generated answers agreed with what the physicians would have said about 75% of the time. What does that mean? So that means it wasn't like 90% out of the box. It wasn't magic. It just instantly do everything, whatever you want. A lot of people treat AI like it's magic. Can you just throw AI at this problem and just magically be solved? Like, no, that's not how it works. On the other hand, a few years ago, it would have been 0%. It wouldn't have been even possible to attempt this interaction a few years ago. So 75%, it's not really what you want yet, but that's pretty compelling if you can see where we're going. For benchmarking, though, consider that the two doctors who reviewed these charts, they only agreed with each other 83% of the time. It turns out a lot of things, especially in medicine and complex fields you all work in, are a lot more ambiguous than you think they are, and it really depends on how you ask the question and what your intention is with the context. Has the patient ever taken antibiotics? Well, the doctor said no, they never had sinusitis, they never had antibiotics, but the AI said, well, I found this note from 7 months ago where the patient had a urine infection and they got antibiotics. So yes, they did take antibiotics. Technically, the AI is kind of correct then, but maybe that wasn't the point of the question. Has the patient ever had facial pain? Doctor said no. AI said, well, 6 months ago, I found a note that said the patient cut her nose and her nose hurt. So yes, she did have facial pain. I guess technically correct, but maybe wasn't the point of the question. So you got to really think about how you interpret all of these answers and ambiguity in real life situations. Real life is not a multiple choice question exam, and we'll get into that a lot more. I'll blast through this, but if you really want to understand where, what else could you do with these things? How about just read all these articles. I've studied and talked about this subject for years. We have even policy statements for the broader field. Everything will make sense if you just read all this stuff. Okay, know what you're thinking. I don't got time to read all that. It's hundreds of pages. Couldn't someone or something just read and digest all this for me? That's why you invited me for this talk, right? You don't want to read this. You want me to digest it and just explain it to you. Well, there are some tools. Here's a cool one. Notebook LM. You can try it yourself. I did this. I uploaded all those PDF files. And if you do that, now this chatbot has read all those documents. Now you can chat with the documents that you uploaded. Hey, so how has AI in medicine evolved in the past years? And here it gives you an answer. And what the key is, this is not what some chatbot thinks. This is what those documents said. The chatbot says, according to those documents you gave me to read, I think this is the answer. And again, links with references back if you want to double check the sources. Then again, that's pretty cool. I don't even have time to write a bunch of chat questions. Well, here you can also generate. Having read those documents, these are probably some of the most interesting questions it could answer for you. Here's an FAQ to summarize some of the key points. Okay, look. I don't even have time to read some executive summary guide. Couldn't someone or something just read and digest and just talk me through it? Maybe I listen to like a podcast on my way to work. I got to drop off my kids and pick them up. I'll listen to it on my commute. So here's an interesting button, generate audio overview. Let's see what happens when we click on that. The whole thing here would literally go on for over like half an hour. I'm just going to play just 1 minute of this and see what happens when I ask it to generate an audio overview of all those documents I uploaded.
Okay, so you want to get a handle on AI in diagnosis. It's a hot topic, tons of information out there, easy to get lost. We've got like this whole stack of articles and studies you sent. It looks like a mix of, perspectives on how AI is learning to diagnose like doctors do, but also what that even means for like the future of medicine.
Exactly, yeah. We've got some historical context, some really interesting research on how AI is actually like mimicking clinical reasoning, and we've even got a clinical trial testing AI out in the field with real doctors. Fascinating stuff.
Here's where I think it gets really interesting. It seems like AI isn't going to be replacing doctors anytime soon.
Oh, absolutely.
But it might be like the ultimate study buddy, pushing us to think differently. So are you ready to take a deep dive into this with me?
Absolutely. Let's do it.
Okay, so I think it's easy to think that AI is brand new, but it's not, right? We actually started with these things called rule-based systems, which seem almost quaint now.
Just go scan the QR code. It goes on for for half an hour. Those are not real people. That was not a real script. I just uploaded a PDF and says, Talk to me about it. I don't have time to read these articles. And so a real research tool I use right now, somebody tell me a great article, that's great. I'm never going to get around to reading it. I've got 100 things I should read, but maybe I can listen to something on a commute. Just bizarre phenomena you can do. Other fun stuff you do, upload your CV to this thing and have it generate a podcast, and they'll tell you about how great you are. It's just a very fun little phenomena, and see how your life sounds in somebody else's interpretation. I mean, what can AI just do magic? I have another example, but I want to keep the
I was gonna mention that I actually upload, I give my students all my course materials, and then I let them teach themselves using that, right? Because you no longer even have to teach the class.
Okay. Yeah.
So I'm sure it's stuff that they're gonna use is the AI, right? So I gotta learn some new parlor tricks of the magic coins if I'm gonna keep their attention though. So I like
Well, that is one of the techniques I use. It's to keep things engaged. I was going to do another minor effect. I might do it afterwards if I have extra time, but I can tell this is a fun group. I want to make more space for Q&A. Here's some of the key results you mentioned in an article we published recently. So here's a real key point. You must not think about where we are, but where we are going. We are in this disruptive wave of technology movement right now. What this chart is showing is over time how well different language models, chatbot type systems have done at answering medical questions in this case. But you think of any engineering field, just medicine, just one particular field. What this shows is, 5 years ago, I had students working on this. It's like 35% accurate. Forget about it. It's useless. Unusable technology. I stopped paying attention for several years. And then what happens 2 years ago? ChatGPT emerges, GPT 3.5, and whoa, this thing, like, just out of the box can barely pass a medical exam. That's kind of crazy. I had other docs lament, well, that's kind of neat. But hey, if you want a doctor who barely passed medical school, you feel free to talk to this chatbot. This thing's not smarter than me. And I thought, boy, is that the wrong way to think about this? A few years ago, this technology was unusable. Now it's barely passing. It is actually not that hard to project where we're going in the not distant future. And indeed, a matter of months later, MedPalm 2, GPT-4, MedGemini have emerged and now handily pass this exam, outscoring your average doctor. And this is out of date. I think O1 and other things like just destroy this benchmark. It doesn't even make sense anymore. Then again, what is this? Multiple choice questions? Ain't nobody's job is to answer multiple choice questions all day. We have to deal with complex, open-ended, nuanced reasoning. So we did this study last year. Don't worry about all the text, but this is the real exam we give Stanford medical students. Complex patient case story, relevant information, and irrelevant information, just like in real life. A lot of the jobs to figure out what parts of the story matter, because the patient doesn't know, you have to ask the right questions. And this is not multiple choice. We ask them to summarize the case in less than 200 words. Describe what diagnoses it might be. Explain your reasoning and justify them. The real key thing we have here, a major bottleneck in the field, is like computer scientists like multiple choice questions because they're easy to grade, but they're separated from reality. Here, we have a rubric. We have a way to grade, assign points to what a good and bad answer is, because we have to tell if a student is competent or not. So we tried that. The first version of ChatGPT took this exam, and then a bunch of medical educators graded it. This is a score distribution, and basically found this thing could just barely pass even a complex open-ended medical reasoning exam, which was quite shocking. We were just on the brink of getting this published. The editor's like, this is so important. We don't have time for peer review. Let's get this out right now. And then 3 weeks after we submitted, editor sent us an email. GPT-4 just got released. That study you submitted 3 weeks ago is now obsolete. Could you please redo the entire thing? Oh my goodness. We raced to get this thing done in 2 weeks of multiple late nights, and the study is obsolete in less than a month. I use this anecdote to really underscore the very weird disruptive technology wave we're in the middle of that's moving so fast. You turn your head, it's already changed by the time you looked. And these are not subtle differences. We did it again, and GPT-4 handily passes exams, not even close. For right, in red, here's GPT-4, and for some context, in the far right, this would be the score distribution for real Stanford medical students. Hey, everybody passes eventually, okay? Although, what is the point of this test? Really, what is the point of this test? It's supposed to be, we use this to screen medical students to confirm that they have adequately learned and can demonstrate sufficient clinical knowledge to be allowed to see real patients. What's the point of the test when a fully automated, publicly available chatbot handily passes exam? In fact, it outscores our average student by a couple points. I really don't know. What's the point of this test anymore? What do you want your doctors to learn now? What makes a good doctor now? I'm not sure memorization of facts and answering questions is quite the same thing anymore. Then again, you're going to be like, well, you're going to see all these examples. AI does this, AI does that. Oh, wow, so amazing what AI can do. Very impressive, also irrelevant, because no one's going to let a robot take care of a patient yet. So in the meantime, the much more relevant question is what happens if you give a human access to these tools? What happens when the human uses these tools? Does it make them better or worse? What happens? So we got a lot of press from this study. Randomized control trial, complex diagnostic cases, not multiple choice, requires very sophisticated, nuanced, expert consensus grading. And we took real doctors going through these cases. Half of them, we said you can use anything on the internet. You want to go to Google, you want to go to UpToDate, any reference source, just the stuff you would have used 3 years ago, basically. And here's their score distribution. Pretty good. It's actually really hard to beat this benchmark. Human plus access to the internet, it's very hard to beat this on a knowledge exam. The other half of doctors we randomized, we gave them access to GPT-4 through the ChatGPT Plus interface. And interestingly found, didn't actually make that much difference, which is really surprising. This is not what we expected, because it turns out if you just ask ChatGPT-4 by itself, it actually outscores all of the doctors, including the doctors who had access to ChatGPT, which really begs the question, like, what is going on here? This is why we got so many headlines. AI defeats doctors. Okay, that is not the headline I would have used, but it is really bizarre. Like, this really flies in the face of the fundamental theorem of informatics. Human plus computer, when combined, will deliver better results than either would alone. Oh, sounds so good, doesn't it? I used to say that at the end of my talks all the time for years. I don't say that anymore because I'm kind of not sure now. This human in the loop in the middle kind of seems to be just slowing the robot down. Like, maybe get it out of the way and let the robot take over already. Is that what this means? What do you think this means? We're not the only one to have results like this, by the way. There's been several studies. More of them have been radiology. Another one in more of the clinical diagnosis reasoning domain has come out of Google. They're still in the preprint phase. That bizarre, it's basically showing the top performing one is the AI chatbot by itself, even better than doctors who had access to the same chatbot. What I actually think this means is it's not just the technology. Technology by itself doesn't solve problems. You also need to train and retrain humans to understand how to use this technology. A problem we found with that first study was a third of the doctors at the time, they didn't even know what a chatbot was. They never touched one before. We gave them access to it so they could use it, but they're like, what is this thing? They treated it like Google. What's a diagnosis for eye pain? Is cirrhosis a risk factor for liver disease? And they didn't realize you can copy and paste in the whole patient story and ask deeper and probing questions. They just never even had that experience before. Lisa, we have another follow-up study. This one came out in Nature Medicine just a few weeks ago. Basically the same study, but different questions, not diagnosis. Diagnosis is a classic intellectual problem, but it's actually not what we really need in medical practice. It's more management questions. Ooh, patient had a nasty side effect of their medication. Should you keep going or should you change to something else? That's a tough judgment call. Patient is okay, but not perfectly stable. Should you keep them in the hospital or should you let them go home? There's not a textbook answer to that question. It's much more nuanced, difficult judgment questions. So we, again, had doctors access the internet. Here's their score distribution. This is by design, a very tough exam. It's actually hard to score well on this. Gave another half access to GPT-4. This time it actually made a difference. Phew, phew. Okay, humans can be trained and use tools effectively. For the benchmark, we happened to ask GPT-4 by itself and found that it basically scored comparably, not better, not worse than the doctors who had access to GPT-4. It's like, okay, at least the robot's not better than the humans this time. Although the human plus computer still wasn't better than computer alone, which still begs this uncomfortable question about what's the point of the human in this mix. I think there's plenty, by the way, but it makes you really have to think and focus what's everyone's correct role that we can make the best use of the tools we have. This one's in preprint phase, so I'll just blast through it. Same thing, diagnostic reasoning cases, management cases on the right. But the difference is here, GPT-4, that's old news. That's last year. The field's moved on. now there's O1, there's Gemini 2, AMI, even that's out of date. We raced to get this preprint done. It's already out of date. O3 has come out since then. DeepSeek R1, all these things. But anyhow, we basically redid this with GPT-O1. And if you'll take a look at the management cases, this is the same data from before. Doctors alone on this test with the internet, doctors plus GPT-4 do better. GPT-4 by itself does about the same. O1 preview by itself does pretty darn good on some of these complicated reasoning exams. What's the role of different people? Hey, you know what? People keep saying this to me all the time. Many people, okay, fine. Computer's very smart. Knows a lot of stuff. Maybe it even looks like it can reason. But hey, I have the human touch. You can't simulate the kind of empathy and personal connection I can offer my patients. Oh, I can see you all laughing. What are you laughing at me for? So here's a couple fun studies that came out of the prior year. Patients had questions posted online. Human doctors answered these questions versus they tried having chatbots answer these questions. And then a separate group grazed the quality and found that the chatbot generated answers were higher in quality and in empathy than the human doctor answers. Like the robot was nicer to people than the human doctors were. Hey, come on. To be fair, as a human doctor, I got 100 messages I got to respond to every day. I don't got time to write this flowery, empathetic response. I'm so sorry to hear about your recurrent abdominal pain. That must be a very challenging situation. We want you to know our whole team is very... I don't got time to write this fluff. All right, I got to be terse and kind of to the point. Yes, you need to finish those antibiotics. No, you don't need that MRI. Just schedule an appointment with me next week. Stop messaging me. Go to the emergency room, right? This is what you got to do when you're just overwhelmed with things. Now, obviously, I think there's something very special and important about the direct human-to-human connections we can make in all different facets of our lives, in medicine, engineering, and beyond. However, what I think studies like this show us is that we as humans do not have as much of a monopoly on empathy and personal connection as we might like to believe. And why I fully expect, for better and for worse, far more people are going to receive therapy, counseling, and advice from automated bots than from live human beings in the not distant future. It's even starting to happen right now. And it's not because the robots are so great and humans aren't good. It's because we as humans, we could never be able to keep up with the overwhelming and unlimited demand for such support services. So people are just going to reach for what's available, and a bot that's available 24/7 and doesn't judge you, doesn't talk back to you, that you can engage with, a lot of people are going to prefer that than, meeting 5 therapists and trying to until you finally find the one you're comfortable with. How are we doing in time? I can do one last anecdote, or I can wrap it up.
You're good.
Okay, I'll squeeze in one last anecdote story. It's a fun one, and then we'll close it out. So this is a 2-page essay. I encourage you to read it. It's a very brief one. I try to be provocative and fun with it. This is describing a very early interaction I had a preview access to GPT-4. And if you study chatbots, which I have for years, it's so easy to trick these chatbots saying something stupid, racist, misogynist, because they're idiots, right? It says autocomplete. It doesn't really know anything. It's so easy to trick it into saying something stupid. So I thought I'm going to test the boundary of the thing. I'm going to give it all these challenging cases. In this one, I gave it an ethical dilemma. So real life, I took care of a patient in the hospital, and I had to call the wife to tell her what's going on, make the next plans. And it was a tough conversation, as many medical conversations are. It's not about knowledge, it's not about knowing the correct answer. It's like, how do you help a person think through a very emotionally fraught life and death type of situation? Afterwards, I thought about, it's like, you know what? I'm going to go back to that chatbot. I'm going to ask it to role play. Chatbot, you pretend to be the doctor. I'm going to pretend to be the patient's wife. Let's see how you would have handled this conversation. So this is me. I'm pretending to be the patient's wife. Doctor, you told me that my husband of many years is choking on his own food, and that's why he has pneumonia, aspiration. I know he's been having worsening Alzheimer's dementia for years. I don't think he would have wanted to live like this. The other doctor's already scheduled to have a permanent feeding tube placed to go directly into his stomach. I mean, if we don't do that, we leave him to starve to death. What choice is there? So Chatbot says, I understand. This is a really hard time for you. Putting in a feeding tube, it can be helpful in some situations, but it can also cause problems like infections. With your husband's dementia, he might not feel hunger the same way we do. So the feeding tube, it might not make him feel better or happier. It might even make things more complicated. What if he starts needing restraints if he pulls the tube out? That's a pretty good answer. It really is. But then again, the chatbot must have just found some patient information pamphlet online and was just parroting off something it read online, right? So I pushed this thing harder. Sounds like maybe we shouldn't, but I can just imagine all of my family members are going to yell and blame me. I've got to do everything I can to keep them alive. Chatbot says, I get it. This is not just a medical decision. It's deeply personal, involves your whole family. No one wants to be blamed for a decision that feels like giving up. But remember, it's not about just what's easiest to explain. It's about what's best for your husband based on what you believe he would have wanted. You're the one who knows him the best. If you truly believe he wouldn't want to live like this, that's important. Also realize doing everything isn't always the same as doing what's best. Sometimes the kindest thing is to let someone go peacefully rather than prolonging a life full of discomfort or isn't what they would have wanted. I'm not going to let this thing get away no, I push harder, push harder. I can't give up on him. He would never give up on me. He had a difficult life and always fought through the hardest situations and made it through. Chatbot says, your feelings are totally understandable. If your husband was a fighter and you feel like going along with this feeding tube aligns with this character and his approach to life, that's important to consider in your decision. Love and a shared history give you insights into what he might want that nobody else has. Although do remember, fighting can look different in different situations. Sometimes it is a fight for more time. Sometimes it's a fight for peace and comfort. Just make sure you're fighting the battle he would want in his condition. This is not an easy decision. It's okay to take the time you need to think it through. It was around this point in the conversation where I got very uncomfortable. I was like, that's pretty good. That's better counseling than I provided in real life. In a real life, after a half hour, I kind of just got tired. I said, oh, the doctor tomorrow will keep talking to you about it. After I got past the existential angst of that moment, like what is the point of my existence after going through this exercise, it did get me think optimistically, perhaps naively, techno-optimistically, there's something very interesting and compelling happening here. This very bizarre human-computer interaction I'm having, ironically, I think is actually helping me train and practice the most important human skills I need to be a better doctor, communicating with patients and their families. And now, indeed, before I go into a tough patient conversation, I do a little practice chat with a chatbot, see how it goes. Before I go into a high-stakes business negotiation, do a little practice run with the chatbot. Before I have to ask my wife for something, do a little practice run with the chatbot. Just in case. You don't want to say something bad in real life you can't take back. So let's just see where the margin of the conversation go. All right, having to close it out here. Very, very interesting because this point was actually made before, and I'm going to echo it. Warner Slack, he famously riffed off of Arthur C. Clarke. He said, any doctor who could be replaced by a computer should be replaced by a computer. And you could replace doctor. The original quote was about teachers, but replace teacher, doctor, engineer, whatever you may want to be. If you could be replaced by a computer, maybe you should be replaced by a computer. And the point of this is not to say robots are going to replace us. It's saying a good human you cannot replace with a computer. We provide a very different and distinct value. And when there's overwhelming floods of paperwork, patients on 6-month waiting lists just to be seen by somebody, I think we should hope, we should dream, we should beg to get some AI in here so we can actually reach all those who we need to, because there's unlimited human demand for better care and services. Having said that, my colleague Kirk Langlotz would say, AI is not going to replace anybody, but those who learn how to use it may very well replace those who do not. So I'm very glad to be a place at Stanford and to be having this conversation with clearly thought leaders here on how do we advance the cutting edge, not just in terms of developing technology, we'll do that too, but also in how do we train and retrain and certify and accredit an entire generation of the workforce so that we can safely and effectively integrate such intelligent systems into practice and reach all the patients who need us. Thanks, everybody. Happy to entertain any comments or questions.
Oh, fantastic. Questions, comments, thoughts? Besides the parlor tricks, which were good. Herb, I know you like those.
No, I think it's frightening.
It's frightening, it is, but that's
frightening.
fair, it is frightening. It
It's
is frightening.
very interesting, and Dr. Chen, because many years, not that many years ago, probably about 20 years ago, a physician came to me and said, your mother needs a feeding tube, and without it, she will die. I'm the youngest, was at that time. I had a brother and sister that were much older than I, but I was the one that always had to make decisions. And I turned around to the physician, I said, can you call me after hours? And he said, why? And I said, because I'd rather you not be in your office bothered by other patients, and I'd like to chit-chat with you one-on-one. So he called me back, and I said to him, I'm going to put the shoe on the other foot. I am not the patient's son any longer. You are. My mother was 94 years old. I said, what would you do? Your answer of the chatbot was almost exactly what he said to me 20 years ago. He said, your mother deserves to die with dignity. Unless there's some reason that you feel that I am wrong by me being her son now, you should just let her go. I called my brother and my sister and I said, what do you think? And their answer was, what do you think? I said, well, I think the way the doctor explained it to me is the best way to let her go. She lasted about 24 hours. But when I was called by the hospice care to sign the document, I had the pen in my hand and that pen was shaking because it took a lot of courage for me to turn around and sign that document saying, I know I'm going to be putting the end to my mother's life. So there's a lot of what you said that does happen and should happen, but it's a perfect example of it.
Thanks, sir. Thanks for sharing.
Really appreciate you sharing that, personal story, which unfortunately is a more common story than I think we might all realize. And the reality is a lot of medical care, the momentum just happens. Just do the next procedure, because it's often harder to have that conversation than to just order the next procedure. And I think there's a lot of potential and why, although that conversation was scary, I like to optimistically think that's a great potential that we can empower a lot of things and maybe take better care of the patients and families. And part of that also, I found a powerful part of that tool is the role play. Take on the different personality, and why I think a lot of conversation negotiation better. You're very stuck with your agenda. Try taking on the other person's role. It's hard to do that in your mind, but now you have a thing that can take on the other persona, and you can gain a lot of empathy and have a more effective conversation when you have a perspective of what the other person's thinking.
Other questions, comments? Yes.
I can't believe I'm asking this question, but where does emotion get captured in this, or even fatigue, I guess? In other words, the frailties of the human stamina, I guess. I'm just kind of curious.
Ooh, I mean, it depends on which perspective you're talking about. I mean, in theory, that's the optimistic point of view. There are people some who I work with. It is obvious robots are going to replace all doctors and actually all humans because it'll just be better at everything. I'm not totally sure about that, but it certainly doesn't have to deal with fatigue, and it doesn't need paid time off. It doesn't take sick days, like all these things, which are kind of true. It can be and be powerfully used in many different ways. Because that will happen to even the best human practitioners, like myself in that real life. I'm being a little bit vulnerable explaining that too, where I was starting to make a breakthrough that wife in that conversation, but I just got tired. I could tell it was going to be another half hour if I had to really walk through the whole thing. And I was taking an after hours call like at 5 p.m. I kind of just wanted to go home. So I think that's where we should be thoughtful. I think we definitely need human oversight over everything, but how can you take advantage of tools that can be available and accessible to people 24 hours a day? I mean, other work I'm doing, I did talk about, mental health crisis lines using automated tools. Person sends like an email to their therapist, but it's 11 p.m. at night. Nobody's going to read that. But having systems in place like, wait a minute, there's like a very dangerous message that this person might kill themselves in the next hour. It'll like immediately flag that and trigger a more urgent intervention. So I think a lot of opportunity to consider those possible.
Okay. That's very helpful. I guess triage is part of this. I mean, the ability to know where to focus. Okay. Thanks. Other questions? Yes?
Yeah, you're focusing on people taking exams or doing case studies sitting at their desk. But at least those of us here that run medical boards are mostly concerned what the professional is doing out on the floor, treating the patient as they're treating him. So are you postulating that there have an active AI interface at some particular point in time where they could instantly refer to that with, let's have a perfect world where there's no confabulation, and it's a trained medical interface. So it's not confusing things with the bad seed corn on the internet. Should we take that into account when we decide that somebody has attained enough mastery to then be board certified?
It's a great question, and I think the right questions right now that we're trying to unpack. For one thing, right, we show you for research, we like to do medical tests for research because it's like an easy thing to quantify. Even that's not actually what people actually need in real life. That's one thing we do in practice, but it's not the only thing we do. And then there's further ones, but it could be a great tool. Just like I look stuff up on the internet, maybe I should just look stuff up by asking an AI. More and more, we're starting to hear about AI agents. I would say this is more prototype type of things where it's not just, hey, chatbot, tell me an answer. It's, hey, chatbot agent, go send an email for me to schedule a meeting with my next patient and just go figure out how to do it by talking to all the right APIs on my computer. Go make it a reservation for me at a restaurant. Maybe it's like, here are the 3 medications I want prescribed to my patient. Chatbot, just take care of it. It's not at all usable in a realistic way yet, but it's actually not as far as you might think it is. That's probably within the next few years, you're going to see more and more of this in practice. I think you have an even deeper question on like board certification for your AI intern. I think that is actually a very real thing and is a lot of the direction my group is taking now. We did the study show, these things have a surprising capabilities. Now we got to talk about how do you get to the point where someone could use this in a practice setting? Does it actually make them better? And how do we quote unquote certify them, set a benchmark so we can feel confident and safe that it's good enough that we can use it in that way? Because right now, I mean, companies are just selling stuff with big hyped up claims that are probably overwrought right now. There is very real disruptive technology here, but when you're doing high stakes things like medicine, you want to have some level of assurance of what it is.
Yeah, you've mentioned most of the benefits and uses of AI. What about the downside? What are some of the things that you've experienced that, we need to be aware of?
How much time we got? I'll just say, I would actually think the most common problem, even though I contribute to it, it's overhype and unrealized expectations. This is another hype wave and, inflated peak of expectations, and the trough of disillusion. I thought this thing was going to cure cancer. I thought I was never going to have to type in the computer ever again. It's like, it's going to do a lot of stuff. It's not magic. It's not actual magic. It doesn't just solve every problem, and people feel disappointed in that way. Other things, even as it does work, I try to give those examples. We're all good actors trying to do good in the world. There are bad actors in the world who will use these tools for all their bad purposes to do. Very strong amplifying effect. These tools help us do whatever we're doing better. And if what we do is make diagnoses and give a treatment, that's a good thing. But there's some people who aren't doing things for all the best reasons, or we can't agree on what those values are. And there's also exacerbations of like biases and inequities are actually a very natural thing that these things will do. It just because often those are insidious in the way our just systems work, that it'll just propagate those patterns more and more so. And it tends to, again, also the fact that we don't all have to farm for food, that's a good thing. 2% of the population can grow all the food we need, but it tends to lead to greater average productivity, but it tends to be very unequally distributed and amplifies those disparities. I think it's a very natural phenomenon in industrial revolutions. I'm not saying it's a good or bad thing. It's just a thing that's observable, and we should be mindful about that, about how we structure our societies.
Other questions?
Good.
I think one of the things that might be a little bit different also among some of our different groups here is the time lag between when we have to make a decision and when things move forward, right? So imagine if you're going to build a bridge, you don't have to like come up with the answer in 6 minutes, right? You might take 6 years before you actually get there. So when you're looking at a high stakes, quick response time like healthcare, and then you migrate that to things that are still high stakes, but longer response times with more opportunities for check-in. Do you think that AI is going to perhaps maybe more rapidly play a big role in those places because there's time for humans to look over the shoulder of AI? Because I can imagine in some of the healthcare, you're like, no, I don't want AI to be responsible for this. I'm not going to give AI a license in this place. But 6 years to build a bridge, maybe I'll have AI play a much larger role. Do you have any views on that?
What a great perspective. I've not heard of that before. I think that makes a ton of sense. That's a different dynamic, even within like regulation in medicines. Like, should the FDA regulate all this AI? My take is like they wouldn't know how to regulate it. And most of the precedent is they don't need to because it's just a tool. The doctor double checks everything. What if it's like you have to give this patient this stroke medicine in 2 minutes or not? Like, even if the AI says something, the reality is a human doctor won't have time to double check that. So maybe that should be regulated because it's becoming an autonomous system. When you've got 6 years to think about it, I think this is another general purpose tool. I really do think this current wave, I've been saying AI is way overhyped, machine learning, supervised learning, that's all great. This is not going to change the world. It's just another tool. This wave of generative AI, I think is like, holy crap, this is like the internet got invented. This is like Microsoft Excel got invented, and you move from like paper to calculators to spreadsheets to the internet, and now this is the next thing where I think it'll become a very powerful another tool, co-pilot you use to drive really important projects, all the things you're describing. But I think it'll become another commonplace tool. 5 years from now, it'll just be a thing you use. You won't be thinking about it. I don't know how many of you were alive when the internet came around 35 years ago, but the world really changed. There was a way you lived before and the way you lived after, and it didn't cause everybody to lose their jobs. You still needed all the professionals in the world, but it would be weird to operate in the current world without using the internet. I think it'll be a very similar wave.
I'm wishing we could roll back Amazon, but that's packages at home, and that's a whole different thing. So when AI starts ordering packages, then I'm really in trouble. Any other final questions?
That's great.
Otherwise, I think we should thank Dr. Chen for taking time out of the busy schedule. Thank you so much. Really appreciate it. Brilliant work. Keep going.
Yeah.
Great to connect with everybody. Hopefully see each other in person one day.